Welcome, everyone. Good evening to one and all to the next session of our open evening. We will start off with a presentation to give you a taste of what services we have to offer and what kind of fertility journey you can expect. While we are going through the presentation, the Q&A session will be ongoing throughout. And at the end, we will request your kind feedback so that we can help make this more useful for you. And so please do fill this feedback at the end. And the final would be the virtual tour of our clinic. And please do, remain logged in to avail of the special discount we can offer you. So here we begin. For tonight's open evening, I am Dr. Abha Bhatt. I'm one of the consultants here. I'm joined by Jackie McAdam, who is one of our senior fertility nurses. She's going to be answering your Q&A question and answering your questions. Please put your questions in the Q&A box rather than the chat box. You should be able to see the icon in your screen either on the top or the left, depending on your settings. So please feel free to ask away, and she'll answer your questions. If there are any questions that need to be answered by me, I'll do that at the end. And of course, I have to mention Mana, who is behind, who's the working force behind this open evening. And so here we begin. To start with, a little brief history about our clinic, which was founded back in 1989. So as a team, we have over 36 years of experience, and we can claim to our credit over 8,000 babies. All the procedures in our clinic are performed under one roof, so you don't have to go for any part of the fertility journey to any other place. It is a state-of-the-art, purpose-built clinic, and we provide the entire range of services, starting from investigations to different treatments, including IUI, IVF treatment, surrogacy, egg donation, sperm donation. So the simplest, the easiest, the most basic service that we provide is that of fertility assessment. It may either be for a couple or for a female or a single man. If a female or a heterosexual couple are requesting assessment that includes 2 visits. For a male fertility assessment, it can be done in 1 visit. So, just to explain it a little more, the first visit will be will include will need you to come into the clinic, and you will be seeing one of our healthcare assistants or nurses who would take down your pulse and blood pressure, monitor your height, weight, calculate your BMI, make sure you've completed your history, and collect your blood and enable you to give your sperm if that's included in the assessment. And in the second visit, in case there is a woman involved, you would be having a mini consultation with either me or one of my consultant colleagues, and we will start off with a scan to evaluate your pelvis, including your uterus, your ovaries, do a 3D scan of your uterus, and end with a mini consultation and explain what the findings of the assessment are and answer any questions that you may have. If you feel that you're ready to take this forward and you want to begin your fertility journey, we can assist you with making a consultation appointment, and you can take it from there. In case of a single man, a semen analysis is done in the 1 visit that you come here for, which can be arranged, and this would be followed by a call from the embryologist who can discuss the results with you. We provide appointments for ultrasound assessments, and this can be a routine gynae scan, especially if you've been told you may have a fibroid, or that you have a polycystic ovary syndrome, or some other problem, and you're not sure, maybe a cyst in the ovary. And you want to confirm your findings, or you want to monitor what's happening to the condition, and we can help you with that. In case you're waiting on the NHS for IVF treatment, one step is to check your tubes through a test which is called as HSG. In lieu of HSG, we can do a HiCoSy, which will also be valid for many of the ICBs, and you can shorten your waiting time, because some of the hospitals, there is a waiting time of as many as 6 to 9 months for just HiCoSy. Even if you aren't doing this for the NHS IVF waiting list, you may simply be wondering whether your tubes are okay, are they open, and we can help you get those answers. Saline infusion sonogram is the other scan that we can do to assess the inside of the uterus, to make sure that the inside of the uterus is normal. In the picture that you can see on the screen, you can see a little polyp which is jutting into the cavity, and this polyp can potentially impact your fertility journey, and polyps have been associated with miscarriages in studies done earlier. Okay, right. So all those people who are trying to conceive or thinking of starting a family, it is a good idea to aim for a more healthy lifestyle, because it is well established that a healthy mind, body, and lifestyle can go a long way to help you conceive. Whether you're trying to conceive naturally, or even when you're undergoing fertility treatment, it can optimize your chances. Please visit our website www.fitforfertility.com for more information on how to manage this. About the fertility pathway, the treatment starts with you filling in your details, and this is done on a platform called Fertility Consents. You log in with details that we will send you, will be sent to you by our admin colleagues, and once you fill the forms online, we can start the ball rolling. You will be asked to upload your passport picture, and if you've had any relevant investigations, we would like you to upload those as well, because this may help us give you a more accurate assessment and avoid doing unnecessary tests. During the fertility journey, we advise all our patients to download Salve app. This is an app which is very, very useful, and I think all our patients are really, really happy to use this app, as it gives you information about the medications that you may have been prescribed. And if you have a side effect, you can read up and find out if that side effect is indeed due to that medicine. Otherwise, you may have to report it and get help. It'll help you keep track of your appointments. You can get robust medical information. And most important, if you have a question, rather than having to ring us and wait for us to call back, you can send messages in a secure manner and get answers to those. Once you've completed the fertility consents, your next visit would be an in-person visit into the clinic. And this is only true for those who haven't already had a fertility assessment, because they would have had this done. So if you have never met us, if you've never been in the clinic, it would start with a visit to the clinic, and a nurse would do your observations, including pulse and blood pressure, your height, weight, etc., and do your blood tests for AMH and thyroid function. for the woman, and for the man, a sperm sample will be requested so that these investigations are ready by the time you're up for your consultation. Now, a word of caution is we are a standalone clinic, and for the sake of patient safety, we have we strictly adhere to a cutoff of 34 BMI for starting IVF treatment. This is because sedation safety is paramount, and with a higher BMI, you would be at a higher risk of having complications, and we feel we wouldn't be able to do the procedure in a safe manner if your BMI is over 34, and hence would have no choice but to refuse your treatment. But even if your BMI is under 34, I would still like to encourage all couples to aim for a healthier BMI, which is between 18 and 25, because the more healthy your BMI, the better your chances of pregnancy are, the lower your risk of miscarriage would be. Now, once you've had the pre-assessment, the next appointment would be a consultation. This is routinely done online. If you're more comfortable with having a face-to-face, please do let us know, and we would be happy to oblige. Many of us do consultations from the clinic as well, and we can fit you in one of those appointments where we are consulting from the clinic. The invitation it's done via Microsoft Teams. The invite would be sent on either earlier that day or a day prior, and a consultant would sit down with you and go through your history and talk through the results and outline a plan. If you have any questions, we would be happy to answer those questions. We would send you details of what the treatment is likely to cost, so that we maintain a total transparency on what costs you can expect for the treatment. The next step would be blood tests, which includes for infection screen, for for HIV, hepatitis B, core antibody and surface antigen, hepatitis C antibodies, and chlamydia and gonorrhea. Now, if the woman hasn't already had AMH, we would need to arrange for that and check her antibodies to rubella, which is another name for German measles. Check her full blood count to make sure she has a healthy hemoglobin level, and also check her hemoglobin type through a test called as hemoglobin electrophoresis to ensure that she doesn't have sickle or thalassemia trait. If the woman has sickle or thalassemia trait, we would need to check the male partner to ensure that there is no risk to the baby. Of importance is the point that these blood tests have to be within 3 months of starting of the IVF treatment, and if not done at HEFC, must be through a UCAS accredited lab. Now, we also offer IUI, which is a procedure where the healthiest available sperm is introduced directly into the womb at the time of ovulation. It is used to aid pregnancy in heterosexual couples who have psychosexual problems, such as vaginismus, erectile dysfunction, or premature ejaculation, and it can also be used for women who are using donor sperm to conceive. In couples who are able to have intercourse with no difficulty, it is unlikely to provide a big advantage over trying naturally. If you're starting your fertility journey of an IVF treatment, this would start from the 2nd or 3rd day of your cycle. So once you've completed the blood tests and the consent forms, you will need to let us know that your period has started, and we will arrange for you to come back for a scan. On this scan, we do a baseline check of how many follicles there are present in your ovaries. Now, follicles are structures that are present in the ovaries that contain the eggs, and these follicles need to grow for us to be able to get eggs out of them. So once you've had the scan, we know where the starting point is, and the same day you would start taking injections, which include either FSH or a combination of FSH and LH. You take it at the same time every evening, and these injections, these hormones would encourage the growth of follicles. And this continues throughout the treatment, which can last from 9 to 12 days. The side effects of these medications may be either headaches, mood swings. Towards the end, you may experience some breast tenderness or bloating as the ovaries are going to get bigger and bigger as the stimulation goes on. The second scan would be roughly 5 or 6 days later. On this scan, we are expecting to see follicles which are approaching 11 to 14 millimeters in size. At this time, we would start a second drug, which is called a cetrotide, which is a medication that you would have to take in the morning at the same time, and this stops you from ovulating prematurely. And from this point on, you would be on 2 injections, one in the morning that stops the ovulation, and one in the evening, which continues the growth of the follicles. Each of the scans that you have during the treatment would be followed by a chat with one of our nurses who would A, dispense the drugs that you need, and B, remind you how to take the medications, answer any questions that you may have, and reiterate what information has been given to you by the doctor or the nurse sonographer at the time of scan. As the follicles grow, these release estrogen, and this estrogen has an impact on the inside skin of the uterus, which becomes thicker and gets ready to carry the pregnancy, so to speak. And you can see that this is the lining of the uterus, and you can see what is called as a trilaminar or 3-layered appearance, which is what we expect to see as the follicles are growing. Now, by the time you're 9 to 12 days into the stimulation, you will come to a point where majority of the follicles would be between 14 to 20 millimeters, and the biggest would be around 22 millimeters. At this time, we would say, okay, now you're ready for the next stage, which is egg collection. But before you have that, you need one final injection, which is trigger injection. The trigger injection prepares the eggs and the follicles for the next step, which is egg collection. This is a very critical part of the procedure, and therefore we will advise you in a very detailed manner through both verbal and written instructions so that there is no mistake. Now, once you've had the trigger injection, 36 hours later, you will be asked to come in for an egg collection. On the day, you'll be asked to come about half an hour before the scheduled time of egg collection, and we will record your baseline investigation. Your male partner will be asked to provide a sperm sample so that we can use it to create embryos. And we do the egg collection under sedation. So you're going to be conscious, breathing on your own. It's not a general anesthetic. And the procedure takes roughly 30 to 40 minutes to complete, following which you will be waiting in the recovery to wake up till such time that you're able to walk on your feet and you're fit to be discharged home. Now, what happens in the lab? Day zero. Day zero is the day that we do egg collection, all right? And following on, the days are numbered from 1 and so on. So the simplest procedure that can be done from here on is that of egg freezing. And this is relevant for those women who haven't found the right partner, but who want to preserve their fertility till such a time that they are able to find a partner and are ready to have a baby. So, and since the HFE limitation has been now changed to 55 years, this is open to everyone. There was a time when it was only allowed for 10 years. Now you can freeze your eggs for up to 55 years, but 10 years at a time. The quality of eggs or sperm is better at a younger age. And so therefore, we would recommend that if you're considering freezing of your eggs, the earlier you do, the better quality the eggs would be and the better chances of pregnancy you will have when you are ready to use these eggs. This may be either for social reasons or because you have family history of early menopause, or you've been diagnosed to have cancer, or are due to have surgery that's going to affect the egg reserve. And we offer counseling while you're undergoing this procedure. Now, if you're trying to have a baby, we don't stop at eggs. Now we need to create embryos. There are several techniques by which we can create embryos, and the simplest of those is IVF, where the sperms are simply mixed with the eggs, in simple terms, and make their own way into the egg and fertilize them. In order for us to be able to offer you this, you need to have normal semen parameters at the consultation. You should not have had any history of ICSI. ICSI is the next level of treatment and is an acronym for intracytoplasmic sperm injection. So for ICSI, ICSI is basically injecting the sperm. If we find that the sperm parameters aren't adequate, there is a higher chance that the eggs that we have obtained at egg collection may not get fertilized by the sperm. And in order to ensure that you have a reasonable number of embryos or a reasonable percentage of embryos that form from the eggs, we resort to the process of ICSI, which is done on the same day as the egg collection. This is done when the sperm parameters are low, either the count, motility, or the shape is low, or there may be a combination of these parameters. Or we will do ICSI if you've had to undergo a surgical sperm removal because there was no sperm in the ejaculate. We will also advise ICSI if you are MAR positive and that you have anti-sperm antibodies, because these would impair the sperms from fertilizing the eggs. If you've had a previous IVF and the number of embryos was either low or zero, then again, we would recommend that you have ICSI for the next cycle. Showing you a video of ICSI. So these are sperms. You can see several sperms, and they're not all in the same plane, so some may appear blurred. This is a micropipette which is used to pick the sperm. But before we pick the sperm, we flick the tail so that we can stop the sperm from moving. And then we take the sperm into this pipette and inject it into the egg. So the sperms are selected based on their shape and their motility. So this is the sperm that has been selected and has been immobilized by flicking its tail. It has now been taken into the pipette. Now this is the egg, and the sperm will now be injected into the egg. Okay, so that's the procedure done. Please don't worry about the egg. Once the membrane of this egg cell is so stretchy, within minutes, this will look no different from what it was looking before, and it's impossible to know whether or not it's been injected. So it remains undamaged as long as the quality is good. And in case you have had a HbA testing and this has come up with a low score, and the cutoff is 65%. So if the HbA score is less than 65%, we would recommend PICSI, which includes an additional step before the sperms are selected for injection. And that involves a kit that would enable sperms that are mature to stick to the bottom of the kit, and these sperms are then selected for injection. The next day, the eggs are examined again, and you can see that within the cell, you can see two circles. These represent the genetic material of the egg and the sperm, and only those embryos which have got two of these are considered to be normally fertilized. If the number is different from two, that represents the abnormally fertilized eggs, and such embryos are discarded and cannot be used for transfer. This is day one of embryo's life, and therefore it's called day one embryo. The second day, by the second day, you can see this that the cells have started dividing. The number of cells may vary depending on how fast the cells are multiplying. And by fourth day or after egg collection, it becomes a tight ball of cells. By the fifth day, it becomes a structure which is called as blastocyst. This consists of a tight back of cells, which will eventually go on to form an embryo, form a baby, and the rest of the cells are align themselves on the inside of the shell, and this would eventually form the placenta. There is fluid in between these two groups of cells. At this stage of an embryo, it will try to crack open the shell and then get ready to implant. You can see a little bit of embryo spouting out of from a hole in the shell. Embryo transfer would be done on the latest by the fifth day after egg collection. At Herts in Essex, we do embryo transfers 7 days a week, so that we do it at a time that would maximize your chance of pregnancy. You will be given an opportunity to see your embryos. There's a TV screen in the corner of a theater, and you can see the embryos before they're loaded into the catheter. We offer the option of embryo glue as an add-on treatment. This is a transfer medium which mimics the conditions in the uterus to optimize the chances of pregnancy. In case you have a genetic problem, or you have been diagnosed to have a structural rearrangement in the chromosomes, and this may have either been picked up accidentally or after investigations because you've had multiple miscarriages. We can do PGT-M or PGT-SR and then select embryos that are normal before they're transferred. The third type of PGT is, and PGT stands for pre-implantation genetic testing. The third type of PGT is PGT-A, and the A stands for aneuploidy, which means an embryo which doesn't have the correct set of chromosomes. In human beings, the correct set is 46 chromosomes. And if the egg doesn't have the right, mostly the egg, but sometimes also the sperm, may have an incorrect number of chromosomes. And therefore, when the egg and sperm come together to form the embryo likewise will have an incorrect number of chromosomes. And such embryos will not either implant, or in case they implant, they end up with a miscarriage. Sometimes they can continue to be a pregnancy, and an example of that is Down syndrome. There are some other aneuploidies which are compatible with life, but has quality of life issues for the child. So especially if you're over 38 years or you've had multiple miscarriages in the past, you can consider testing your embryos before your transfer, or you can also consider doing this testing before transfer to minimize the time to pregnancy. There is a 3 to 5 week waiting period before the results will be back. So the embryos have to be frozen in case you're considering PGT testing. In case you're not doing PGT, we can do 1 or 2 embryos to be transferred into your uterus 5 days after egg collection, up to 5 days after egg collection. In case there are any surplus embryos, those can be frozen with or without biopsy, depending on how you want to, depending on your wishes. So this is the pathway of IVF, and from the day of egg collection, you would start taking progesterone, which is called as luteal support, up until the day of pregnancy test, which is 16 days after egg collection, roughly 12 days after the embryo transfer. And if this is positive, we would do a pregnancy scan after 3 weeks of the pregnancy test. We offer NIP test, which is non-invasive prenatal testing, which is a blood test that a pregnant mother can have once she's completed 10 weeks of pregnancy to test for chromosomal abnormalities in the baby. We also offer egg donation and sperm donation. Egg donation is typically offered to women who are over the age of 45. Your chances of pregnancy over the age of 43 is less than 5%. So women who have had early menopause or have had chemotherapy or in a previous IVF treatment have been told or diagnosed to have a poor egg quality, can consider egg donation. Some women are born without ovaries. Single men or same-sex male couples may combine egg donation with surrogacy in order to complete their family. Sperm donation, likewise, may be considered if there is no sperm production or if the sperm production has been stopped due to chemotherapy. Some couples may consider it because they don't want to pass on genetic disorders that the male partner carries to the child. Sperm donation is a great option for single ladies and same-sex female couples as well. At Herts Essex, we have completed more than 387 cycles since 2012. We have a dedicated surrogacy team for the intending parents and surrogates so that all parties know exactly what's happening, and we can liaise with all parties and make sure the process goes smoothly, and we take care of all the details of the treatment so you have a optimal success. Many of these cycles may also include an egg donor, especially in case of male same-sex couples. Single people using own gametes can also have a surrogacy, which is of 2 types: full or host surrogacy, in which the embryos belong to you through your eggs and sperm, or donor eggs and sperm, or partial or straight surrogacy where the eggs belong to the surrogate. We have contracts with several ICBs and offer NHS-funded IVF treatment. And these ICBs include Mid and South Essex, North Central London and North East London. Please note that your ICB is determined by the location of your GP and not your home address. And these are the ICBs included in the Northeast London ICB, and these are the areas: so Barking and Dagenham, Havering, Redbridge, Waltham Forest, City and Hackney, Tower Hamlets and Newham. Mid and South Essex ICBs include Mid Essex, Castle and Rochford, Basildon and Brentwood, Thurrock and Southend. And North Central London ICBs include Barnet, Camden, Enfield, Haringey, and Islington. In case you're not eligible for NHS funding, there are other ways. You can consider embarking on egg share scheme or sperm share scheme, which can help make it more affordable for you. Please talk to one of our egg donation or sperm donation teams for more details. We can offer you the autumn special offer, which includes a 50% discount, provided you book your new consultation by Friday, 26th of September. The new consultation typically costs $250, and you can have it at a discounted price of $125. Please note this does not include blood tests or semen analysis. We have partnership with Access as well as Assured Fertility, who are the financial institutions which provide funding, and they both provide 0% finance. Please look at their websites for more details to see if this is something that you would like to avail. Emotional support provides protection against internal and external factors, and we really are passionate about wellness at Herts and Essex. And Mana works tirelessly through our social media platforms to give positive vibes to all our clients who engage with us. So please do join our social media. We have been on TikTok recently, and I think we're doing we're having quite a lot of success on TikTok. In order to optimize your chances of pregnancy, as I mentioned before, it is important to have an optimal BMI. In case your BMI is not not at a healthy level, you can seek consultation with a dietitian that you'd like, and you can get the details from the Association of UK Dietitians, so that you have professional help to achieve an optimal BMI in the shortest time possible. So in short, we would recommend ourselves to you on the basis of our over 36 years of experience. We are open 7 days a week for laboratory services. We have an electronic witnessing system to enable an accurate treatment. This would prevent any mismatch or errors so that the right egg and right sperm are used to create the embryos and the right embryo is transferred into you. We can claim credit for over 8,000 babies. We are known for providing a great emotional support throughout the fertility treatment. And what doesn't hurt is a free parking that we can offer you. We value your feedback. We would love to hear what you have to say about this open evening. Please do complete this short survey. And Mana will be sharing the link for the SurveyMonkey that you can use. I hope you've been asking questions from Jackie and keeping her busy, but please do also follow us on our social media platforms. And these are the details of our Facebook, Twitter, Insta, LinkedIn, YouTube, and TikTok. If you want to book an appointment, you can call us on 01992 78 50 60 or email us at inquiries@hertsandessexfertility.com. The current waiting list is, I think, less than 4 to 6 weeks now, but please do get in touch and we can help you get an appointment at the earliest. Okay, so we will not stop this session till the every last question has been answered, so please ask away. I hope you've enjoyed this presentation and this has piqued your curiosity and you're asking more questions. Thank you for your time. Please don't go away. I'm going to now stop sharing this and share the virtual tour of our clinic. Right, here we go. All right. So with this, we end our open evening. I'm going to leave the platform, but please do continue to ask your questions and we'll answer all of them before closing the session. Thank you. Goodbye. Have a lovely day.